This topic is mainly for what pharmacy technician people. Okay, right. So first topic is prescription and abbreviations. Right. So how do we define a prescription? Who writes the prescription?
Doctor.
Physician,
Doctor.
doctors, right? So what is it? It is a legal written instruction, right? And doctor writes it for whom to read? Pharmacist, no? Right? So it is a legal what? Written instruction written by a licensed healthcare provider, which is a physician, to a pharmacist, right? And what is present in prescription? How to prepare and administer medication, right? That is meant for whom? The patient, right? So it is a what? Written instruction from a physician to a pharmacist for the patient. Yes. Okay, right. Now, it is written for therapeutic drugs and controlled substances mainly, right? For drugs like antibiotics and all, controlled substances like morphine, right? Codeine. And it can be also for medical devices in sometimes, right? During sometimes it can be, but for the medical devices also, right? Now, how are this prescription delivered from the physician to the pharmacist, right? It can be hand delivered, right? Patient may take the prescription from the physician and give it to the pharmacist. No, that is what happens usually. Who takes that? Pharmacist, patient in the provider കൊടുത്ത prescription pharmacist കൊണ്ട് കൊടുക്കല്ലേ ചെയ്യുക അല്ലേ? So it is given by hand, no? Hand delivered, right? Sometimes it is faxed or through computer, or verbal prescriptions are also given emergency situations, right? Patient, this physician might call the pharmacist to dispense a particular drug in emergency situations. Yes, right. So that is your prescription, right? What are present in prescription, right? First, there will be date. Yeah, the date has to be there, right? Then there will be patient's information, right? Name of the patient, date of birth of the patient, right? Address is present only when we are talking about controlled drugs. Okay, like diazepam, morphine, and all. No? When you are giving, you have to what? Have the full address of the patient, right? So, and also prescriber's data, right? So, date will be there, patient's information will be there, right? Prescriber's information will be there, right? Apart from that, you will have inscription, right? The medication name, right? Which drug needs to be given in what dose, right? What is the dosage form? Like tablet X needs to be given for 300 mg, right? So that information will be there, inscription, right? Then signal, direction for the patient, like how much to take, like one tablet twice a day means one tablet BID will be there. No? Okay, that is called signal. Okay, right. Then you have subscription. Subscription is the information instruction given to the pharmacist to how to give it, right? And then finally, you have prescriber's DEA number. DEA stands for Drug Enforcement Agency. What is it? Drug Enforcement. Just a second. Okay, Drug Enforcement Agency, right? So DEA number usually prescribers who prescribe internationally. There will be prescribers, na? Like if you international prescribers are those doctors na, who write a prescription, it will be valid all world over. Understood? Right. So they have a what DEA number, and DEA number must be there when you're prescribing what controlled medication, like when you're prescribing this diazepam, morphine like drugs, na, the prescriber's DEA number must be there on the prescription, right? And they should also sign on the prescription, and it should be hand signed. Okay. Sometimes what happens, physicians they give a stamp, na, right? Where their name, everything is there. They don't sign, right? But that is not permissible if the drug is what? Controlled drug. Clear? They must what sign it using their hand. Clear, no? So what and all will be there? Date will be there, patient's information, right? Then there will be what? Inscription, the drugs name and dose, right? Then there will be what? Signa, which is direction for the patient how to take it, right? So like take one tablet twice a day. Then there will be subscription, which is information to the instruction to the pharmacist, right? How to compound it and all, right? Then prescriber's DEA number will be there in case he's prescribing what type of drug?
कंट्रोल ड्रग।
Control drug, right? Control drug.
मैम वो इंटरनेशनल आपने कुछ बोले वो क्या थे वो?
DEA number ना, DEA number is ये प्रिस्क्राइबर्स जो होते हैं ना इंटरनेशनली जो प्रिस्क्राइब करते हैं, they
हाँ।
have this DEA number, right? And all the prescribers who prescribe internationally, they will have this Drug Enforcement Agency number, right? DEA number. We'll discuss that in detail. Okay, right? DEA number. And if the prescriber is prescribing a controlled drug, na, like I said, morphine, right, which comes in class two, right? Then drugs like diazepam, alprazolam, right? Controlled drugs, right? Which have this abuse potential. If they are prescribing such a drug, they must mention their DEA number. Clear? Hmm. Right. So next. Okay, so prescription processing steps. What do? You check for the validity, whether the given the prescription that has come to you is valid or not. Right. Then you identify the patient. You confirm the patient who has brought it is the same patient. Means you will confirm the name of the patient, date of birth, everything to make sure na ki prescriptions are not what drugs given matches the prescription clearly, and the patient is also right, and you have to make sure the allergic history as well as insurance information. Sometimes na they are what companies give insurance na, right, and during that time the policies are different, right? So sometimes you may give what 60 tablets or something, right? But when somebody is having the insurance, the maximum days for which you can dispense is 30 days only.
ओके।
Understood, right? So you have to make sure what type of prescription it is, right? Whether it is a valid one or not, right? You have to make sure that verify the patient, right? His allergy history, everything, and the insurance information, right? So once you have done that, you have to what? Enter the data into the system. So here and all, we just look at the prescription, make sure it is right, and then dispense, right? But in foreign countries and all, what do? They take the prescription from there, they enter the information into their system. Understood, right? So what and all will should be entered accurately, patient complete details, right? Prescriber's information, right? Then NDC number is a number given to the drug medicine. It is a number given to the medicine which identifies that medicine, right? So NDC number is what? NDC number is the national drug code it is, right? So this code will be specific for a specific drug. Each drug will have a different NDC code. So either you can type in the name of medication, or you can write down the NDC number. Understood? Okay, right. Then you have to write down the quantity and day supply. Day supply means how many tablets are required for a single day. TID means three, na? Right? So if you're suppose giving one tablet TID, right? So days supply will be three, right? Right. For total 30 days, if you are giving, how many tablets you will give? Into
90।
that is 90 tablets. That also you have to mention, right? So you have dispensed how many? 90 tablets. Okay, 90 tablets, right? Then expiry date you have to mention from the bottle, right? Whatever batch you took, it will have that expiry date, no? Right? That also you have to mention. And finally, refills, right? Number of refills and all we will learn. Okay, clear now? Okay. Right. So we have different scheduled drugs, and there is what different refills allowed, and they're valid for different time period. Right. So for example, we have what controlled schedule one controlled drugs. Okay, schedule one is there, two is there, then three, four, and five. So how many control drugs? How many schedules are there? Five. Five types. Okay, five types are there. Right. So this schedule one na, is highly abusive in nature. So we don't use it clinically, right? So you have this drugs like diacetyl morphine and all, heroin, right? MDMA. They are not used clinically, no, but they have high potential, right? To cause what? They have high abuse potential, right? So such drugs come in what? Control one.
कंट्रोल।
Okay, one first schedule. So they are not imported, they are not exported, they are not prescribed, right? So we don't have what? A refills or validity, anything no, for them. right? They are not prescribed, right? Okay, so that's why we don't have it. Now, control C is 2C. Okay, C2 is the drug with high abuse potential, like morphine, oxycodone, and all. Your opioids, no? They come under this class. High abuse potential, right? Addiction, addictive in nature, right? So, such prescriptions don't have refills. Means once, suppose the doctor writes it for 20 days, right? The prescription comes to the pharmacist will dispense the drug for the 20 days, right? If the patient comes with the same prescription, he will not get it. Clear? So refills are not allowed. But in case your uh, prescription contains class 3 to 5 schedule C3 to C5. Okay, so drugs like codeine, diazepam, your benzodiazepines and all, right? Antidepressants. They are also what? Having abuse potential, no? Control drugs only. But thing is, they can be refilled for 5 times. They can be refilled 5 times maximum. For example, suppose a prescription is prescribed, dated, what is it, date today? 21? This 21, no? Is it?
Yeah. Yeah.
21, 6, 2025. Right. This is the prescription. What was written? Diazepam tablet, suppose. Okay. The patient has to take for, suppose, say, 1 year. Okay. He's on this. Okay. Right. So the pharmacist will dispense it for 30 days. Right. After 30 days, if the patient comes with the same prescription, right, he can get what? It for a next 30 days. Right. Like this, he can refill it for maximum how many times? Five.
5 times.
Right.
Okay, 5 times. And the validity is for how many months? 6 months.
Months.
Okay, 6 months. Clear, na? Right.
Yes.
Now for non-controlled drugs, like you have your normal BP medications, antibiotics and all. Na? You antibiotics, you don't take it chronically, but BP medications you do, na? Take it chronically, na? For diabetic patients, they will have their drug, right? Oral hypoglycemic agents and all. Right. So such prescriptions, they can have a maximum refill of 11 times, means up to 1 year it will be valid. You will get it dispensed the first time when you get the prescription, right? After that, you can what? Refill it 11 more times. So, total, how many times you will be getting the drug? 12, no?
Right.
Right. Maximum refills means once dispensed. After that, you can get it dispensed 11 more times. Right. So, it is valid for how many months? 12 months.
12.
Okay, 12 months. So you have schedule one, which is not prescribed, right? Not dispensed, nothing, right? They are not used clinically, right? Highly abusive drugs, right? Then you have class two, high abuse potential is there, but it is clinically used, right? Morphine, oxycodone like drugs, right? No refills are allowed, valid for, prescription is valid for 6 months, right? Class 3 to 5, sorry, schedule 3 to schedule 5 up to. They have low abuse potential, moderate to low, right? They can have a maximum refill of how many times? 5, right? 5.
Right.
Valid for how many months? 6.
16.
Okay. Non-controlled drugs. Non-controlled drugs. Maximum refills is how many?
11.
11, right? And it is valid for
12 months.
12 months, right? Then we talked about the EA number, na, verification. Yes. So international prescribers or those who are US based, right? They have this DEA number, right? So DEA number usually contains two alphabets, letters, right? Followed by 6 digits, and there is one more digit, okay, which is called the check digit. So total two alphabets followed by 7 digits. Understood? Yes, right. Now, suppose a prescriber writes a DA number, right? You must
Mm.
know whether it is right or not. How to check it? Okay, that comes at it may come in exam. So, which of the following is a correct DEA number? They might ask, right? So what you have to do is see the first alphabet. No? First alphabet usually can be any of these, right? A, B, C, D, E, all these, right? So depends upon what type of prescriber is the prescriber means what type of registration he has, right? So in most of the cases, the prescriber is a practitioner. No? Most doctors, they are practitioners. No? So they will have what? C as the first alphabet, right? Now, suppose somebody is in defense, right? And there they are practicing. We have, no, in army, navy and all, right? The doctors are there, right? So they will have G in front. So first letter in their case will be what? G, right? If they are working in a teaching institution, like in medical colleges and all, then they will have what? D. So depending upon that, uh, what type of registration they have, they will have what? Different letters, right? So that is your A. No, sorry, first one. First alphabet. Understood? This first alphabet, right? Then there is B. B, no? So what is that? The second letter is first letter of the prescriber's last name, right? So see here, the name is what? John Smith, right? The doctor's name is John Smith. The last name is what? Smith, right?
Smith.
Smith. And the first alphabet of the last name is S, no? Right? So the second letter will be what? In his case, Dr. John Smith's case, it will be S, right? S, right? So if he's a normal practitioner, right? So his first two letters will be what? CS, no?
Yes.
Okay, then it will be followed by what? Seven different digits. Clear? Okay, now how to confirm it whether it is right or not? What you have to do, no? So you have got the first two digits, okay, that is done. Name of the prescriber will be given. So you can check no, whether the last name's first letter is that only. Okay, right. So if it is any name you can think of. Let's take an Indian name, no? Right? Okay, Satish Kumar, suppose. Okay, right. So in this case, what will be the second letter?
K.
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 Okay, K. Right. So first is suppose he's a normal practitioner, say K. Understood? This is how it looks, right? After that, it has six letters. Now, so you take up the odd ones, right? Odd ones. Okay, so first one, three, and five, and add these up. So first odd letter one, odd number one, then comes three,
3. 5.
three, three, then
5.
Five.
five. Okay, right. So you don't take the last number. The last number you don't take, right? So what is the answer? When you add these two, you get nine.
Um,
Then now take the even numbers. Okay, now even numbers. Now even number is 2, 4, and 6. Na? Yes, you take 2, then add 4 and 6. When you add these, you get 12, right?
right.
Multiply by 2, you get 24, right? Then you have to add these two, the first and the second. Okay, right. When you add, you get what? 33. The last digit here na, should be the last digit of the DEA number. If it is, it means the DEA number is correct. Clear? What we did? We took the odd numbers first, added it, right? And then we took the even number, then added it.
And multiplied by
And so
2.
that we got multiplied by 2, we got 24, right? So whatever the answer you get in first and the second case, you add those two up. Clear?
Mm.
Right? Now, after that, whatever answer you get, the second digit should be the
The last one.
last number of the DEA number. Clear?
Yes, ma'am.
Right. So here is got 33 and 3 and 3. So this DA number is correct. Clear, na?
Yes, ma'am.
So that is your DA number, right? Now when prescribers write prescription, a prescription should be tamper resistant. Means in such pads they should write, especially when they are prescribing what type of medications controlled ones, right? Why? Because the patient should not be able to what make changes in that prescription, right? So they are such prescriptions are called what? Secure paths, right? So
Okay.
pharmacist technicians, what is their job is to make sure to verify the prescription, right? If they see anything unusual, right, they should report it to the pharmacist. Clear, right?
Mm.
Now, if the prescription is being transferred from say one pharmacy to another, right? Earlier, a pharmacist was what dispensing the drug, right? Now
Mm.
he's transferring, maybe because of some reason, he's transferring from one pharmacy to another. Then the prescription should be received by the pharmacist only. Understood, right? And because he will have to verify everything and enter into his system, right? The information, everything, right? So whenever prescription transfer take place, who is responsible? The pharmacist.
Uniform.
He should what? Uh, Receive it, right? Now a pharmacy technician can also do it, right? Can input the transferred prescription, but first it should be verified by the pharmacist that everything is right and not. Okay, so once pharmacist has verified everything, then it can be what? The inputs and all can be done by the technician. Clear, na?
Yeah.
Okay. Now, in prescription, what and all should be there in prescription? Complete thing. We talked about this, no? Right? Pharmacy info should be there in the label, right? So name, address, phone number you have to mention, right? Then their RX number, right? License number there, right? The patient's name, date dispensed, when did you dispense it, right? The date you have to mention there, right? Drug details you have to mention, direction, right? Prescriber's information, especially the DA number in case the drug is a controlled drug, right? Prescriber's
Mhm.
complete information should be there, including DA number, right? Expiry date of the medication you have to mention, right? Number of refills that can be done and how many you have done. If this is second, you will have to write the date. Now, so date will tell you the prescription date will be there and the dispense date will be there. So that will tell you how many times it has been dispensed. Understood, right? Then NDC code, which is the code to identify the drug, right? If it is there, or the name, right? Then auxiliary labels, what are they? Auxiliary labels. Some drugs might should be stored in what? Away from light, no? So that will have
Mm.
such drugs will have a label, right? Some drugs can cause drowsiness, like your first generation antihistamines, right? So there you will write what may cause drowsiness, right? So that is called second auxiliary labels, right? Or some drugs needs to be taken with food, like your ibuprofen, naproxen, and all. Otherwise, they might cause what GI disturbance, right? So you will write what take it with food, right? Now, when you prescribe, sorry, not dispense levothyroxine like drugs, what you write? Take it out empty stomach, na?
Empty
Right,
stomach.
right. So such labels are called what? Auxiliary labels. Okay. Okay. So auxiliary labels, shake well before use. It will be for what type of drugs? Emulsions or suspensions? Huh? Right?
Suspension.
Suspensions. Avoid sunlight. Don't take it with alcohol. Metformin. Right? Should not be taken. Right? Okay. Metronidazole. It may cause what? Disulfiram like action. Very important point. Right? Which drug? Metro.
Razzle.
Okay, metronidazole, if taken along with alcohol, it will cause what? Disulfiram-like reaction, right? Then, for the ear, for the eye, you have to mention specifically. Otherwise, they might what? Take it orally. No, you don't know, right? So you have to mention whether it is for eye, whether it is for nose, whether it is for what ears and all, right? Second generation, first generation antihistamines, they cause drowsiness. You have to mention that also, right? Okay. So those are what? Auxiliary labels. Okay, just a second. Okay, now next is commonly used prescription abbreviations, right? Okay, we'll try and learn it. So AC ante means before, right? C is Sibos, Sibos is meals, right? So ante Sibos is before meals. Before means, right? So if AC is written, it means what? You have to take it before meals. Okay. Okay. PC. P for post. Sibos again. Right. PC is after meals. Right. So what is AC? Before meals. PC is after.
After meals.
Okay. After meals. Then you have AD. Right. ADAS. This is small. Okay. It's by mistake. Yeah. ADASAU. So A is Oris. Oris means your ear. What it is? Ear. Right. D stands for dexterous, which is your right. Okay, so wherever you see D, it means what? Right.
Right.
A, A for
Or
oris means ear. Okay, ear. D for right. S for sinistra, which is left. S for left. Okay, and you have U. U means
both.
both. Both. Okay, so this thing you learn. What? And one more. O for oculus. Oculus is no? Eye, no? Oculus.
Ah, yes.
Oculus is eye. So A for oris, which is ear. O for oculus, right? Means your eye. D for right. S means left. U means
Both.
both. Right. So what is OU?
Or ocular.
Both eye. Yes.
Both are. Ah,
Right. Both. No? U is both. Right. O is eye. So oculus. Uh,
you
you.
means both.
Which is
Both.
both eyes. Right. So if it is AU, it means both
Years.
ears.
Yes.
Yes, both ears. Right. Now, if it is
Yes.
OD, sorry, not OD, there is O. We don't, OD means, if you write it capitally, it means once in a day. Right. Small OD means what? Oculus, eye, both,
Plus extra.
right eye. D, na? Okay, D, right eye. Clear?
Hmm.
Okay, now, SD, then it is
SD.
No, not
Left.
S. Sorry. OS. OS, it is
Left.
left eye, right? Left eye, understood?
Mm.
Right. So if it is AS, then it is
Left ear.
understood, no? Left ear, right? If it is AD, then
Right here.
yes, right ear, right? Right ear. Then UD,
Both
Both
ears.
here.
okay. Understood. OU, okay, not UD, OU. It is difficult, na, making up questions. Huh? Clear, no? Right? So O is oculus, A is ear, D right, S left, U both, right? Both. Clear, na? So you have A D, A ear, D right. So right ear. Yes. A S, A ear, S left. So
Left.
left ear, right? A U, A again, ear, U
Both.
yeah,
Both.
both,
Both.
right? So both ears, right? Both ears. Similarly, O, I, D, right? Right eye, right? O, oculus, I, S is sinister, which is left. So left eye, right? O, U. Why am I stressing on this? The question has come from this area only. That's why, right? You may get confused, na, here. Confusion is more here. That's my question. They are also asked from this area only, right? So O, U is what? O
Mm.
is oculus, U
Both.
is both, right? So both eye. Clear, na? Okay, right. Then you have ophthalmic. Off is used optic for ear. Okay. Anti-meridian means morning, AM. AM, PM, na? Again, small letters. Okay. AM, right? Then PM, post-meridian. Because, yeah. Okay. PM is post-meridian, right? BID, twice a day. TID, thrice a day. This we know, right? QID, 4 times a day. QOD, every other day. QOD is what? Every other
Other
day,
day.
means alternate days. Today, then not tomorrow, day after tomorrow. Clear? Okay. Then important ones I'll tell. Okay, start means now. Take it now, right? That is the meaning. Na? Start. Yes.
That.
Then DAW is dispense as written. Okay, this is usually direction for the pharmacist, right? What is PO? Take it by mouth.
That.
Per OS, right? But per OS means take it by mouth. Okay, then SL, you know, na? Sublingual. Yes. No, no, sublingual. Yes. Then we have PR. PR means in rectum, right? PR is in rectum, right? Then GTT, which is drops.
No.
Okay, drops. Gutta it is actually. GUTTA. So what is the meaning? Drops. Okay, drops. Then HS, hora somni. Hora somni means somni. When do you sleep? Night, no? Right? So hora somni means at bedtime you have to take it.
In that
Just,
time.
at bedtime. Hora somni. Right? I'll be sharing this, right? So I'm telling you the ones from where questions I have seen, right? Not all. So certain things you know, BD, BID, QID, TID. Just go through this, okay? All of this, right? So aura, somni, yes. Then CC you might have seen instead of ml they use CC, no? Cubic centimeter, right? So CC is nothing but cubic centimeter, which is what? ml.
ML.
ml. Okay, ml. Then ASAP, as soon as possible. We use that also, no, these days while messaging,
Mm.
right? So that is the same thing, ASAP, which is as soon as possible. QS is quantity sufficient. Okay, quantity sufficient. Clear. Then they will use the things like Roman letters 1, 2, 3, and 4. And you know that, no? How it's written. Okay, right. Okay. S is half. Half. Okay, not one. So if you have to write, take half a tablet, you will write what? SS. You will use what? SS. Means senior half. That is the meaning. Okay, half. Clear?
Mm.
What did we learn? AC,
Yes.
antecipos, PC, posipos. After
Mm.
means, right? A stands for what?
Right here.
A.
A is ear,
Ear.
E for right. Yes?
Right.
Right. Then you have AS means ear again. S is for
Ear.
left. Right,
Left.
left. AU again ear. U is both.
Both.
Right. O oculus. O stands for O. Oculus means eye. D right. Yes. O again, I, S for left. O,
left.
U. O again, I, U for both. Right? Both. Okay, very important. Okay, in this area. Then ophthalmic, right? Of you use optic, ear. AM, anti-meridian, right? Morning. PM is evening. We know this. BID, QID, TID, right? We all know this. QOD. QOD is every other day.
Every other.
Other day. QD is every day.
Okay.
Okay. QD is every day. PRN is as needed. PRN is what? As needed. Important. PRN is as needed, right? Now the question that came, PRN, what is the meaning? PR, PRN.
Direct.
Huh. So in rectum, when needed, as needed. That is the
Mm.
thing, right? PRN, right? So they will give us a whole thing and then ask you what it is, right? So PRN is what? In rectum, as needed, right? Okay. Then SS is, we said half, right? PO is by mouth,
But
right? By mouth, right? PV is in vagina. Then gutta is what? Drop, right? HS is
bedtime.
parasomni means at bedtime, right?
At
Somnish
night.
at night. But, we don't write at night, we write at bedtime whenever you're going to sleep. Okay, right? CC is what? Cubic centimeter, right? Which is ml, nothing but ml. ASAP is as soon as possible. What is stat?
Um, as needed.
Mhm. At once, now, no? Stat.
Once.
As needed is?
Now.
Uh-huh. As needed is what? PRN, no?
PRN.
PRN, right? PRN. Clear, no?
Uh,
Okay. Sometimes you might have seen that some problem is there with the batch and we have to recall the drug from the market. Not talking about uh, sometimes what happens, we have to what? Recall, right? So drug recall is the action that is taken up by the FDA, right? To remove prescription drugs products from the market. Okay, because they're concerned with the safety, efficacy, or quality. Okay, it can be
uh,
safety, efficacy, or quality, right? So there are three different types of recalls, okay, from the market. What it is? Class 1, class 2, and class 3. Okay, most serious and dangerous type of recall is what? Class 1 recall. Okay, so here there is a reason to believe that exposure of the drug can cause serious adverse health consequences, that it has a potential to cause death, right? If recall is not done promptly, right? So that is what? Class 1 recall. Clear? Class 1 recall. Most serious type, right? Most serious type. So if the drug reaches the patient may die. So that much serious it is. So sometimes what happens is if something has been dispensed, suppose by the pharmacist, na, right? By mistake, and they get a notification from the manufacturer saying that there is something wrong with the batch. What they do? They call the patient directly, right? And they ask them not to take it. Clear?
mm,
Right. So that is what class one recall. Prompt action should be taken, otherwise, there will be what? Serious health issues. Right. Class one recall. Then you have class two recall, which will not cause death, but may cause some adverse health effects. Okay, not serious harm, but may cause some adverse health effects. Okay, so they are what? Moderate severity. Right. Class two recalls. Now, class three recalls, it is not going to cause any harm to the patient, right? But is a for example, if something wrong with the label, right, which might not cause any problem to the patient, but there is something wrong, no? Right? So you have to take care of that, right? Okay, so that is what? Class 3. So which is most serious type of recall? Class 1.
one.
Okay, then class 2 and finally class 3.
Mm.
Right. So, example of class 1, contaminated sterile injectables. Now, if it is contaminated, they are given directly into the bloodstream, na? Injected, right? So, it may cause what? Infection, right? Now, if the drugs are mislabeled, right? Or the route of administration or something has been mislabeled, then it can again cause serious problems, right? So, that is what? Class 1.
One.
Okay, class 1, right? Class 3 is some what packaging errors, minor errors. Okay, that is class 3, right? So it is usually the recalls are initiated sometimes by the manufacturers or it is made compulsory by the FDA, right? Anything can it depends upon the situation. Now, class 1 recalls require immediate pharmacy and patient notification, right? So manufacturer will call the pharmacy and tell them there is a problem. Take care of the batch, right? Don't dispense it. If they have mistakenly dispensed it already, they will again contact the patient. That's why we need to have what patient information with us, no? Right?
Mhm.
This will help in recall scenarios and all. Clear, no? Right?
Mhm.
And what is the duty of the pharmacist staff? Is to remove all the recall drugs from the shelves. Otherwise, it might be what dispensed again. No? We don't know, right? So if such a call comes, what you have to do? You have to remove everything from the shelf. Clear? Okay, right. And if something, a recall drug is discovered by the technician, they should inform the pharmacist. Okay, of it. Clear now, children?
Yes, ma'am.
Okay. Prescription interpretation. Right now, when you look at the prescription, you go through it, you have to make sure that everything, abbreviations, everything are clear, right? If it is not clear, you have to tell that to pharmacist, right? You should never guess the meaning. If there is any problem, either ask the pharmacist. If pharmacist also has confusion, he should call the prescriber, right? You should never guess anything that is there on the prescription. Guessing may lead to mistakes, which can sometimes be really harmful. Yes, so no, never ever guess, right? Now, and then translate the abbreviations to plain language for labeling. Like if they might have written what? PC, post, what? Meals, right? So you have to write what? Take it after meals for the patient on the label. Na? They will not understand. Na?
Mhm.
Yes.
Mhm.
Okay, clear.
Yes, ma'am.
Now, useful references books in pharmacy. We have the United States Pharmacopoeia. Likewise, in India, we have what? Indian
I
Pharmacopoeia.
think,
IP. Then USP, Information, Volume 1 and 1 to 3, right? All these are what used by professionals, yeah, as well as what? Patients for what? Information, right? Then you have Remington. Questions come from these three books. Remington, compounding
yes,
and formulation information you get from where? You get from Remington, right? Compounding and formulation information, right? Uh, Red Book, it contains drug prices, right? So insurance companies, manufacturers mainly use Red Book. It contains the wholesale price of drugs. Okay, drug prices, which book? Red Book. Okay,
Mhm.
Red Book. Orange Book contains therapeutic equivalents. Means if you can't give one drug or if one drug is not available, you can substitute it with a therapeutic equivalent. No? So you must know na, which therapeutic equivalent it is and what is the dose. So such things are mentioned in Orange Book. Okay, Orange Book. So therapeutic equivalents mentioned in which book? Come on. Orange
Orange book,
Book. Drug prices are mentioned in
red book,
Red Book. Okay, Red Book. Compounding and formulation issue mainly present in
Remington.
Remington. Okay, Remington. Clear?
Yes.
That is your prescription, right? Prescription. Now, DA number, how you have to find out that you have to learn. Okay, understood now how to? First number, registration type will, first alphabet will tell you the registration type. Second one will be the first digit of the first alphabet of the last name.
Last name.
Last name followed by a six digit and then a one more digit, right? So you if you have 1, 2, 3, 4, 5, 6. Why am I stressing on this? Because it is important. Okay. So you will add the odd numbers first, right? Whatever answer you get, say you guess X, right? Then you add the even numbers, right? You get Y multiplied by 2, right? Then if you get Z, suppose you will add X and Z together, right? And if the answer is say any MN, then N. The last digit should be here,
The
the
last
last
number
digit
of
of the number that you get. Clear, na? So that is how you find it. Okay, next is dosage form and route of administration. Okay, now dosage form, it can be either solid, liquid, semi-solid, or gaseous, no? Right? So physical formulations, dosage forms that are delivered to the body, right? So you make that is physical state. Now, what is dosage forms? You may make the drug into a formulation, like paracetamol can be made into a tablet, which is a solid dosage form. It can be made into a suspension, which is a liquid dosage form, right? So dosage forms are forms which help in administering the drug. Yes, we convert a drug to a particular dosage form for ease of administration. For example, if you are treating an adult, paracetamol is better as a tablet, no? Right? But if you are giving it to a child, see, he may not be able to take a tablet. So you will have to formulate it as a
syrup.
suspension.
Suspension.
Okay, suspension, right? So that's it. That is what? dosage forms. The dosage forms make it easy to deliver the drugs to the body. Yes, right. Now, so based on physical states, we classify dosage form as solid dosage form. We have liquid, semi-solid, and gaseous. Yes, right. So solid dosage forms. Which are the solid dosage forms? We have tablets,
tablet.
huh? Tablets, capsules, powders. Right. Powders are solids only, no? Right?
Yeah.
Then lozenges and suppositories, right? So tablets are nothing but compressed powders, right? Powders are compressed to get tablets. Examples are paracetamol, aspirin tablets you have, right? Sometimes they are scored, no? Like this, so that we can what? Split it,
Ah,
right? Now
yeah.
make it into half, right? Then you have capsules. You have two different types of capsules, no?
Yeah.
We have what? Hard gelatin capsule and soft
Hard
gelatin capsule, right? Hard gelatin capsule usually contain powders or sometimes what pellets and all, like in omeprazole, right? We have pellets, right? Then soft gelatin capsules usually contain what? Liquids, no?
mm,
Right? We might have seen pudin hara, no?
yeah.
Right? So that is what? Soft gelatin capsule. It is soft, right? Fish oils and all come in soft gelatin capsules,
It's not
right?
enough.
Okay,
Mm,
right. See, omega 3, it contains what? Omega 3 fatty acids, right? So that is capsules. Now, capsules, they have a size ranging from their value, no? Ranging from 000 to 5. Okay, important thing, 000 to 5. So the what are the values? You will have 000 tablet size, okay, 000, then 00, then 0, then 1, 2, 3, 4, and 5, right? So as we come down the number, what happens? The size of the capsule increase or decrease? Size.
decrease.
Huh? Increase or decrease? Okay, which one is bigger? 000 or 5? A or B?
Five.
5 is bigger.
Yeah.
No. 000 is the biggest one. Okay, so as we go, as the number increases, size decreases. Opposite. Okay, so 000 is the biggest capsule, right? Then it is usually hard gelatin, okay, not soft gelatin. Then 5 is the smallest. Clear? Size. What happens to the size as we come down? It decreases.
Decrease.
Okay, decreases. Okay, from 000 to 5. Right. Then you have powders. Right. Powders. They are pre-measured dry form. Right. Powders.
Yeah.
Right. So usually antibiotics are present. Right, in powdered form. Then just before taking it, you have to add the sterile water for injection. Or sorry, sterile water to it, and then mix it, and the baby takes it within 7 days. Yes or no?
Ah,
So we have that. No? So that is dry powders, right? Then you have lozenges, which you keep in mouth when you have throat infection and slowly suck on it, right? Strepsils and all are the examples of what? Lozenges. Hard it is, right? Mainly contains sugar and all, right? So it gives you a sweet taste also, right? And then it contains what if it is being used for throat infections, it might contain some uh, what antimicrobial agents, right, and antibiotics, right. So that will treat the throat infection. You should not what take it what should not swallow it. What you have to do, you have to suck on it. We keep it in the mouth and suck on it, no? And the
mm,
drug is released from there, no? Slowly, right. It's hard in nature, no? You have seen the strepsils,
yes, ma'am.
right. So it gives you what local action on the throat, no? The
Mm,
inflammation and all goes when you use what lozenges, okay, lozenges. Then you have suppositories, right? Suppositories are either inserted into the rectum or on into the vagina, right? We have paracetamol suppositories for babies and all, right? And also diazepam and all, right? Come as suppositories, right? Now, what is the advantage? Suppository can be given to a person who cannot take oral dosage form, no? Right? If the patient is vomiting, suppose, right, or is or unconscious, you can't make him eat or drink or anything, right? So in such cases, you can use a local area, right? Suppositories, right? So suppositories, the drug usually, most of it, right? Most of it goes directly into the systemic circulation, bypassing your first pass effect, liver metabolism. Clear? Some of it, okay, not completely. Clear?
mm.
Okay. Next is your liquid dosage forms, right? Liquid dosage form, you have solutions. In solutions, can you see any phases, different phases? No. Can you see? No, no. Clear solution it is, right? So whatever drug is there, it is what? Dissolved in the fluid. Yes, that is solution, right? So that, you cannot see anything. There is only one phase, right? Example is saline, cough syrup and all. Saline, when you look, can you see two different phases? Anything getting, what remaining suspended or something? No, no. It looks like a plain water, right? Right. So those are what? Solutions. These are what? Homogeneous liquid. They are clear, right? No suspended particles, nothing. Clear, na? Now, what are suspensions? Suspensions is when you're dealing with insoluble particles, right? You have, for example, when we take paracetamol, no? Paracetamol suspension. When you look closely, you can see the particles, right? Being suspended in a medium, right? So that is what suspensions. You have solid particles suspended in the medium, right? So that's why when you keep it for some time, it might settle. These are particles, na? They might settle, right? So what we have to do before giving the drug? Shake it,
Well,
right? Shake well before use, right? It is the auxiliary label is for what? Suspensions. Okay,
suspension.
suspensions, right? The suspensions are solid particles suspended in a liquid medium, right? Then you have emulsion. Emulsions you make when you have oil and water mixture. Yes, yes, right. In most of the cases, either, just a second. Okay, right. So oil might be suspended in a liquid medium, right? So it is what type of suspension? It is oil in water type, where oil, small globules, right? Oil as globules are suspended in water medium. Okay, aqueous medium, we call it what? Oil in water type, right? Oil in water type. So here the continuous media is what? Major one is water. No? So it's not sticky, right? Water is the major content, right? Oils are being suspended, no? Right? Continuous medium is what? Your water. Now, if in oil you have suspended water, the globules are water, and the medium is, if it is oil, it will be what? Water in oil type, no? Water and oil type, right? So this type are really what? Sticky in nature, right? So most emulsions are what type only? Oil and water type only.
All water.
Okay, and what is the example of a natural emulsion that you see? Milk. Okay, milk is a natural emulsion. Okay, emulsion. Why? Because fatty milk has fat in it. No? It is present as globules only. That's why we don't see it. No? Small, very small
Mm.
globules, right? So emulsions, right? So example of drugs which is given as emulsion, propofol. Okay, your IV anesthetic, right? Propofol. Okay. So again, it should also be shaken well before use, no? Because it can also what? Settle a bit, right? Clear. So that is your
Fine.
suspension and then emulsion. Finally, syrup. Syrup contains what? Sugar, right? What percent? 66.6% weight by volume, right? That is syrup, right? So it is sweetened viscous liquid, right? And to this syrup you add what? Drugs, right? So babies like it, no? Right? Because it is sweet in taste, right? So dextromethorphan syrup is available, right? Paracetamol syrup is available, right? So what are syrup? Syrups are made by adding sugar to
Sugar.
water. How much sugar? 66.6 gram of sugar in 100 ml of water, right? So it is highly concentrated preparation. Yes, right? And that's why syrups don't need any sort of antimicrobial agent. Why? Because its viscosity is really high. Bacteria will not be able to thrive there. Okay, viscosity is really high, na? Right?
Mm.
Concentrated preparation, na? Right? So if bacteria goes inside it, what will happen? Through osmosis, water will come out of bacteria's body, right? And it may die. Highly concentrated, right? That's why, right? So syrups, sweetened, viscous, liquid, right? Mainly used for which class of which population? Pediatric
Pediatric.
population, babies, right? Clear, no? Then you have
Mm.
semi-solid formulations. Which are the semi-solid ones? Ointments you have creams, gels, and paste, right? Ointments, they are greasy usually, no?
Yeah.
Ointments are greasy, right? They give you a occlusive effect, right? Example is petroleum jelly used for dry skin. Then you have creams. Creams are usually water-based emulsions only, right? So usually, and they are what? Not as greasy as ointment. Ointments are more greasy, na?
वाटर बेस्ड मतलब मैम ऑयल इन वाटर जो बोले वही ना.
हाँ हाँ वही, right? So water is the major medium. That's why when you apply it, you don't feel that greasiness. Creams and all, when you apply, the cold creams are different. Cold creams are water and oil type. That's why they leave a oily feeling after you apply it, right?
Hmm.
Creams usually are what? Non-greasy in nature, right? So compared to ointments, creams are always non-greasy, not much greasy. Clear?
Hmm.
Okay, then example is hydrocortisone cream, right? It also absorbs faster because water is the major medium. So absorption is faster from the skin. Okay, gel. Gel contains alcohol in it. They are semi-solid alcohol preparations. So when you go to take a uh, ultrasound and all, they apply a gel on the top of your skin. No? Might not
Yes.
notice, right? So that is gel, right? And you have a that cold feeling no, when they apply it. Why? Because it contains what? Alcohol, right? Okay. Then for pain relief and all, we can apply what? Diclofenac gel, right?
Hmm.
So it dries also quickly on the skin because it contains what mainly? Alcohol, right? Which evaporates, no? Right, when kept in open space, right? Then you have paste, right? What is paste? What is the difference between paste and ointment? Ointment have less amount of medicament, whereas paste has higher amount, right? That's why it is more thicker. Okay, so that is paste, right? Example is zinc oxide paste. Clear, na?
Hmm.
And finally, gaseous dosage form. So aerosols, right? Pressured inhalers and all, like we have salbutamol inhaler, right? Salbutamol used for what? Asthma, COPD, right? Then we have nebulizer. Nebulizer, where what is nebulizers? What do they do? They convert liquid to small droplets, which is called mist, right? So might have seen those when children or they have difficulty breathing and all, we give them nebulizers, no?
Hmm.
Right? Sometimes using a saline, or sometimes you may have to add a drug, right? Inhalational agents like budesonide, inhalational corticosteroid. Okay, clear, na? Right?
Hmm.
It requires a compressor, means it will a thing that converts your liquid to mist. That is called compressor. Clear?
Yes.
That is gaseous dosage forms. Right. Okay, next final one. Routes of administration. Right. Enteral route. Enteral means pertaining to your GIT. Right.
Yeah.
Starting from mouth all the way to anus. Right. So starting from mouth, we said, right? GIT, stomach, intestine, and finally anus, right? Okay. So mouth, PO,
Hmm.
per by mouth, right? Most
I
common.
know.
By mouth. What you take, tablet, capsule, syrups, everything are taken by mouth, right? What is the advantage? Easy, no? Most easiest, right, way to give. And it's not invasive, no? You're not giving it by injection or something, right? So it is painless. Yes, right? Advantage. Now, what are the cons? If you take something orally, it will get absorbed from the body, right? And will go to liver no? For metabolism, to undergo metabolism, right? So bioavailability will be what? Less, na? In case of oral dosage forms. Yes or no? Sabrina has gone. I feel nobody's there. Yeah. Others, clear, na?
Yes,
Okay.
ma'am.
Right. Huh. Next is sublingual. Okay. Sublingual, you place it below the tongue, right? So below the tongue, here, right? Just beneath the tongue, right? What is the advantage? It below the tongue you have a lot of blood vessels, no? Okay, from there the drug is absorbed and it doesn't go to liver, directly goes into systemic circulation. Yes, so that's why it bypasses what? First pass metabolism, right? So whatever is given directly reaches the systemic circulation. Action is really fast, right? Example is when somebody experiences angina, what do they take? Sublingual tablet of nitroglycerin. Okay, so that is sublingual. Then you have buccal. Buccal means you have to place it between your cheek and gum, right? So this is the gum area, right? You place the tablet between the cheek, right, and the gum, right? Gum, right? So that is buccal. Okay, buccal, right? Again, there also, no, in the cheek area, that is very delicate, right? So you will have what? Blood vessels, a lot of blood vessels. The drug get absorbed from there. Which one? Buccal. Sublingual, you know, no? Sabri, below the tongue, no? You have to place the drug.
Yes, ma'am.
Yes. Then you have rectal, right? Suppositories, enemas, and all are given rectally, right? Now, it is given when the patient is unconscious, right? Vomiting and all.
Hmm.
Rectal route is preferred. Yes. Then you have parenteral routes. Okay, you have IV, intravenous, intramuscular, subcutaneous, and intrathecal. dermal, right? IV, you're giving directly into the veins, na? Blood, right? Reaches the blood directly, right? Directly into the veins, yes.
Right.
So what is it? Bioavailability 100%. Whatever you give reaches the systemic circulation, right? Immediate effect you get, right? But there is chance of infection also, na? Right?
Mm.
It is contaminated. You cannot do anything, then, right? Because there is no barriers, na, to prevent it, right? And if any mistake occurs, it is irreversible also, no? You cannot what take the drug out, no? You will have to what take procedures that might help to eliminate the drug from the body, like giving them antidote or making the urine alkaline acidic, gastric lavage. Such things you no, not gastric lavage is not possible. Hemodialysis, such things you may have to do, but once given, what you cannot take the drug back. Clear? So risky, but very much effective also in emergency situation, right? Get immediate effect. Clear? That is
Mm.
IV. Intramuscular, you're giving the drug directly into the muscles, no? Right? Muscles, right? 90-degree angle. If you give, it goes directly into the muscles. Which drugs are given? IM, vaccines. Okay, penicillins and all are given. IM, right? How much you can give? Maximum 3 ml. Okay, in adults, the maximum amount that can be given is what? 3
Three.
ml, right? Now, then subcutaneous. It is given under the skin, right? SC. The most common one is insulin. We give SC, no? Right?
Yes.
Fatty tissue, right? Fatty tissue. This one, yellow area, right? Fatty tissue. Now, maximum volume that can be given is very less compared to
Mm.
intramuscular and IV. IV, you can give what 100 ml as much as you want, right? And you can also give irritating drugs IV because your veins and all, they don't have nerve endings. They don't feel, so when our veins they come in contact with irritants, we don't feel any irritation, right? So irritant drugs can be given IV. Clear, right?
Mm.
But you cannot give them subcutaneously because you have a lot of neurons there, right? Irritating drugs cannot be given SC. Okay, and the volume is also less compared to IV and intramuscular. Okay, it is only 1 to 2 ml, right? Maximum, right? Intramuscular up to 3 ml. IV you can give 100 ml also, right? We infuse drugs, right? Then you have intradermal, right? Intradermal. Might have seen TB,
Uh,
tuberculosis. The vaccine that is given is how is it given? Intradermally, just beneath the skin. Okay, just beneath the skin, right? So introduced into the dermis portion. Clear? IV, IM, SC, intradermal, right? So IV, immediate effect, intramuscular subcutaneous will take some time, a little bit more time, right, than IV, but less than your oral. No?
mm.
Action is faster than oral, right? Subcutaneous should not give irritating drugs. Yes, IV you can give irritating drugs. Subcutaneous, the maximum volume that can be given is 1 to 2 ml, not more than that. Clear, na?
Yes, ma'am.
Okay. Then you have topical. Topical, which gives you localized effect, right? On skin, you apply creams, ointments, right? Patches, the cotton patch, fentanyl patch, right? Such
Yeah.
patches can be applied on skin, right? So it will, what you have to make sure is when you apply something on the skin, it should be lipophilic. Lipophilic, only then it will move through the barriers, no?
Yes,
Right?
ma'am.
Dermis, whatever, epidermis, dermis, and all, and then reach the systemic circulation, right? So that is skin. Eye, you apply drops, ointments, right? On the eye, right? Ear, you have ear drops, right? For infection and all, you can give antibiotics, no? Right? Intra nasal sprays, it can come, right? Drops all are also available, right? What do they do usually? Um, Drugs like
Yes.
hmm, oxymetazoline and all, they are what? Nasal decongestants, no? Right? For decongestion only, we use what? Majority of the cases, we use what? Nasal sprays or nasal drops. Clear, no? Then other
Mm.
routes are inhalational route, salbutamol inhaler, then transdermal, fentanyl patch. Right. Okay. Then you have something called extended and delayed release dosage forms, right? So why do we use sometimes this extended release dosage forms? Because they're mostly in form of tablets only, and they release the drug slowly, right? Slowly, right? So usually they release the drug for 8 to 24 hours. What is the advantage? When they release the drug slowly, we need not give the drug again and again. So when you give extended or delayed release dosage forms, they decrease the frequency, no? Number of times that you need to give. Sometimes the drug might be needed to give, you might need to give it 3 times a day, suppose, right? But if you are giving extended or delayed release, you may have to give it only once. Understood, right? Frequency decreases, right? Now, there are a lot of different terms that are used for this extended release. Okay, and they are what? Long acting preparation, we say time release, delayed release, prolonged action, right? And they are usually what? Typically, they are tablets only, tablets or capsules, right? So, what are the abbreviations that are commonly used for extended release? We use CD, which is controlled diffusion. CR, controlled release. Okay, CRT, controlled release tablets. If they are, we write CRT. Okay, LA, long acting. SA, sustained action. SR, you might have seen in tablets and all, SR written, right? Sustained release. TD, timed delay. TR, time release. XL, extra long. XR, extended release. So all these are same thing, right? These are the different terms that are used. Okay, clear.
Yes, ma'am.
So questions. Okay, we'll look at the questions. What does the prescription 2 GTT OS QID into 5D mean? 2 means 2, na?
Two
Right? What
drops.
GTT? Drops.
Drop.
Good. Drops.
OS
S
by
OS.
I
I
left eye, left eye.
S.
Left
Okay.
eye.
Good. Left eye.
QID 4 times a day,
4 times a day for
5 days.
5 days. So answer is
2 drops in left eye 4 times a day for 5 days.
yes.
D.
Understand? Na? Easy, na? Right? So for you to answer this, you must know what abbreviations correctly, right? So OS, OD, UD, US is what they use in majority of the cases. Understood? So you should be clear with that area. And the other things, if you come across in the question files, right? In the files, if you come across anything, learn those also, right? Be thorough with the abbreviations, right? So answer is B. Next, the first letter in DEA number identifies first number. First letter, sorry. You have 2 letters, na? Followed by 6 digits and then a one more digit, right? So first digit is
And
first name of the prescriber, type of drug prescribed, type of
in which
registrant,
it's issued.
uh-huh.
No,
State,
type of registrant.
type of registrant, na? Whether he is what normal practitioner or not, or whether he's a defense practitioner, whether he's a nurse, he or she is a nurse with what prescribing power, right? So it depends, right? So that is what A at type of registrant.
Registrant.
Okay. So we have got A, B, C, and M for practitioners, right? C is the common one, right? A, B, C, and M. G for defense practitioners, right? Now, what is the meaning of abbreviation HS?
At bedtime.
Very good. At bedtime, right? Which abbreviation indicates that a drug should be taken 3 times a day?
PID.
Such simple questions do come for technician exam, okay? Right. Which of the following is an example of parenteral drug administration? Parenteral.
Intramuscular.
Yes, IM, na? Sublingual, rectal, oral, and all are what?
Other
Enteral.
forms.
Enteral ones. Okay.
Enteral.
Enteral means somewhere in the
GIT.
GIT, right? Somewhere in the GIT. Parenteral means you're bypassing enteral route. That is parenteral. This is not parenteral as we say, it is parenteral. Right? Means it is bypassing your enteral route. Clear?
Hmm.
The term, okay. The term PO on the prescription means
By mouth.
by mouth. Yes. Which of the following is not a solid dosage form?
Suspension.
Suspension. Which of the following dosage form is designed to release a drug over an extended period?
C, sustained release.
Sustained release. Immediate release will release the drug then and there. Right?
Hmm.
Okay. Sustained release, SR capsule. Yes. Clear topic.
Yes.
Mm.
Just a second.